The Coordinating Minister of Health and Social Welfare, Professor Ali Pate, has outlined the Nigerian government's renewed effort to address the country's drug abuse problem. Now, drawing attention from this year's commemoration of International Day Against Drug Abuse and Illicit Trafficking with the theme, "The evidence is clear, invest in prevention," the Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, reviewed readiness to improve access to treatment and raise awareness. Here's the rest of the story.
According to report, only 40% of high-risk drug users in Nigeria currently receive needed care, highlighting the massive unmet need. To close this gap, the federal government said it is intensifying efforts to address funding gaps as well as partnering with law enforcement agencies at reducing substance abuse while ensuring a balanced public health approach. Consultations are ongoing. The Coordinating Minister of Health and Social Welfare, Professor Muhammad Ali Pate, represented by its Permanent Secretary, Daju Kacholom, at the commemoration of this year's World Drug Abuse Day in Abuja, revealed plans to engage communities, traditional and religious leaders to intensify more efforts on mental health and substance use prevention.
Thus, the Ministry of Health, as part of the renewed hope agenda of Mr. President Bola Ahmed Tinubu, GCFR, has commenced infrastructural upgrade of some federal tertiary hospitals. And these include our federal neuropsychiatric hospitals, our federal teaching hospitals, our specialty hospitals, and our federal medical centers to provide drug-related healthcare service delivery across the nation. Federal government subsidizes health. I'm sure we all know that, like they subsidize in education, they subsidize health. We have federal tertiary hospitals, teaching hospitals, medical centers, specialty hospitals, including the neuropsychiatric hospitals. And they are all mandated and designated to treat drug users, all federal tertiary hospitals.
The representative of the National Drug Law Enforcement Agency, NDLEA, Odomelam Chile, attributed the high prevalence of drug abuse to factors such as poverty, unemployment, and porous borders, which contribute to the region's vulnerability to drug trafficking and abuse. He advocated for investments in education, job creation, and community development initiatives to empower individuals and communities against drug abuse.
The region's porous borders and proximity to major drug trafficking routes make it a vulnerable transit point for illicit substances. Recognizing the significance of prevention, the international community has designated June 26 as the International Day Against Drug Abuse and Illicit Trafficking. Investing in education, job creation, and community development initiatives can empower individuals and communities to resist the horror of drugs. Investing in prevention is crucial to address the complex challenges of drug trafficking and abuse.
The World Health Organization representative to Nigeria, Walter Kazadi Mulombo, called on the Nigerian government to improve access to prevention, early detection, and treatment services for drug use disorders.
It could be associated with HIV, it could be associated with hepatitis B or C. There has also survey evidence come out the prevalence globally as well as in Nigeria. So that is the area also we should look at, but we also acknowledge the effort of the government, that prevention effort has been done. So there is also evidence come out that in Nigeria, the HIV situation in people using the drug also has been, that death has been declining, so that life expectancy has been longer. So that can also see that this is the product of the effort, collaborative effort to prevent and then minimize the harm. So then with this occasion, we would like to call on the government to strengthen and improve access to drug use prevention, early detection and treatment services for the drug use disorder.
The federal government of Nigeria says through collaborative efforts between the government, NGOs, healthcare professionals, and community groups, efforts will focus on increasing access to regulated substances for medical purposes while preventing diversions to illicit markets.